Receiving a diagnosis of diabetes can be overwhelming. Let's listen in on an education session with a newly diagnosed type 2 diabetes patient and her certified diabetes care and education specialist.
Hello, I have been looking so forward to meeting you. My doctor told me last week I have diabetes. I have been doing a lot of reading, and my biggest fear is that I'm going to have to start on insulin shots.
Oh, I hope after today that you'll feel more comfortable about that and won't be so scared, but I can understand. But remember, the most important thing is you're here today, which means you're motivated to learn more and take care of your diabetes. To start, there's a couple different types of diabetes, type 1 and type 2. Do you know what type you have?
Yes, my doctor told me. I have type 2 diabetes, and the doctor started me on the pill.
Okay. So type 2 diabetes is very common. And oftentimes people will get it when they have a family history of diabetes. While type 1 diabetes, your body actually isn't making any insulin at all, so you would require insulin injections. Type 2 diabetes, you may or may not need insulin injections, so oftentimes you can start on an oral medication to manage it. But remember, it is a progressive condition, so you may eventually need insulin.
I see. I'm going to try really hard to eat right and exercise so I can eventually get off the diabetic medicine.
Gosh, Terry, I think that's a great plan. Yeah, absolutely. Healthy eating, exercising, getting your weight to a stable place and keeping it there. Those are all things that are kind of in your control with your diabetes.
My mom has diabetes. She always took the oral pill. And then 3 years ago, she was started on insulin. I don't understand because she does everything right. She diets, she exercises, she watches everything she eats.
Well, that's a perfect example of a progressive condition. So it's a good thing she was taking such great care of herself, or she may have needed that insulin much earlier. With type 2 diabetes, your body may not be using the insulin properly, or you may not have enough insulin and you may require those insulin injections. But it's out of your control if your pancreas isn't making the insulin.
I see. If I had to start on insulin, that would make me feel like a total failure. My mom was really disappointed when she found out she had to start on insulin.
The important thing really is that she was taking care of her health. So if she wouldn't have chosen to take the insulin, she wouldn't have been able to get those blood sugars in good control.
Okay, that makes sense. Are there any side effects to insulin?
Like all medications, there are side effects to using insulin, but actually not as many as there would be if you were on oral medications. The biggest one that we would talk to you about is hypoglycemia, or that low blood sugar.
I heard about that. I heard that's really scary.
Yeah, absolutely, that can be scary. But Terry, if you do ever start insulin injections, we will have a lot of training for you. We'll make sure that you know how to use that insulin. And a lot of times it's when people aren't taking the insulin the way the doctor's prescribed that they end up having low blood sugar. But we make sure you feel comfortable knowing how to treat a low blood sugar too, in case it did happen.
Okay. Also heard that insulin can cause weight gain. Is that true?
It can, and actually that's a good way to know it's working, but we can talk to you about overall calorie intake to make sure that you can minimize those weight gain side effects.
So if I start on insulin, will I have to continue to take the pill?
Well, sometimes people are on oral medication with their insulin, and it's more the supplemental insulin that's added to the routine. Remember, the oral diabetes medicines work in different ways on different organs in your body to manage your diabetes, but your doctor is going to help you figure that out.
I am so glad I came to see you today. I feel so much better now. I'm going to continue to work on my eating habits and exercise and just try to take better care of myself. But at least I know starting on insulin is not really a bad thing. But what really is important is keeping my diabetes in control so I can live a normal, healthy life.
Absolutely. I love your positive attitude. So now tell me about some of those changes you've already started making for your diabetes.
Well, one thing I do is I use the carb manager.